Can weight loss drugs help you reach your health goals? Well, to know this, we're joined in by our special guest, Dr. Alexandra Sowa, a dual board certified physician and author of the book, The Ozempic Revolution, who now shares the pros and cons of using GLP-1 medications. Dr. Alexandra, thank you very much for taking the time out, joining us here on ET. Now, there's been so much chatter about Ozempic, but tell me this, what inspired you to write The Ozempic Revolution, and what patient gaps with respect to GLP-1 did you identify in your practice?
So as an obesity medicine doctor in the United States, I've been practicing exclusively in this field for well over 10 years. And just a few short years ago, even though we had GLP-1 medications to use, patients knew so little about them. And so as we as a country and as a world have started to embrace these medications, I realized that the rate of writing a prescription was going faster than the knowledge base. And so I wrote the Ozempic Revolution to take all of my experience of how to eat, how to think, how to change your lifestyle alongside these medications to ensure that you not only feel well, but that you have success on them. It really became clear to me that it was time to write this book because I had so much, the privilege of having so much experience, and I needed to give that to all of the patients out there.
All right, and as you pointed out, Doctor, how does your Sowa Method integrate with GLP-1 treatments to enhance patient outcomes?
So these medications are a miracle because they help people lose weight that has been impossible to lose, and not only lose it, but then maintain their weight loss. And beyond weight loss benefits, there are a whole host of other benefits: cardiovascular, metabolic. We can stop the progression from prediabetes to type 2 diabetes. And then in the future pipeline, you'll see even decreased risks of cancer and dementia. And it's just truly amazing. But if you just take the medication alone and you don't make any changes to your life, you might not feel in control of the weight loss, which is worrisome for people, and you just might not feel well. The whole point of these medications is to really help you transform your health, not just to get thin. So in the Sowa method, this method I developed in my medical practice over the past 10 years, it really incorporates three main components: the habit foundations, the food foundations, and then the mental and thought foundations. People traditionally associate dieting with food, so they might understand that you have to pay attention to what you're eating, but I lay it out very clearly. The habits also can feel familiar to people. Thinking about planning your food for the week, potentially writing down your food, making sure that there isn't an emotional component to food, that you're really eating for hunger and you're stopping when you're full. All of those things people associate potentially with previous dieting attempts. These medications, though, help you to reframe how you're looking at it. Instead of thinking, oh, I have to diet again, it'll say, oh, I actually have the mental bandwidth and the decreased hunger and the ability to follow through on these habit foundations. I'll say the thing that's very, very unique in the Sowa method, and the thing that I think is often being ignored by doctors who are writing this prescription, is the thought and the mental foundations. The vast majority of long-term weight loss, I believe, has to do with how you're thinking about your weight loss.
Dr. Alexandra, as you point that out, and of course you help us draw better perspective on that front as to what that outcome can be. On the other hand, what are the key things a patient should keep in mind before beginning the GLP-1 medication?
So I think the biggest thing for people to understand about a GLP-1 medication is that this medication is helping to fix a hormonal imbalance that's happened in your body. People think fat is an accumulation of a lack of willpower, or it's solely just about what you've eaten or how little or how much you've exercised. But really, obesity is a disease, and excess fat is linked to hormonal dysregulation. So the brain no longer talks to the pancreas and the gut and the fat cells in the way that it was built to do. And instead of easily burning your fat, it will store more fat when you eat. And GLP-1 medications help regulate this pathway that has gone amiss. So the thing that people need to know beyond that it's a disease is that potentially, and most likely, in order for you to see continued success on this medication in terms of weight loss or blood sugar control, or to see the full benefit of health, you will have to stay on this medication long term. It is just like treating your high blood pressure with a medication or your underactive thyroid with a medication. We will encourage you to do all of the lifestyle things, right? Go to the gym, eat well, low inflammatory foods. But even with that, you might need a medication to help control those diseases. And the same thing is true when it comes to GLP-1 usage for weight loss. This is something I really want people to understand. This is not a quick fix. This is not you go on it, you lose the weight, and then you're guaranteed to be able to come off. Some people may be able to come off, but it's likely less than 10% of people who start this medication will ever be able to come off of it. So that's a big, big thing to know. The second big thing to know is that these medications, although you might just be hearing about them for the first time, they're not new. We've had GLP-1 medications out in the world, very well studied from the early 2000s. So they've been out in the world for almost 25 years now in clinical use. And people will always say, well, let's see what happens in 5 years with side effects. Well, we know what happens. We've studied those patients and we have a very large data bank of people on these medications.
And, talking about the other aspect, how do you envision the role of GLP-1 is evolving in the broader context of obesity and, of course, metabolic health management?
I think that we haven't seen anything like this medication potentially since the advent of antibiotics. I truly think this medication class is going to transform the way that we approach chronic disease. Obesity has taken over the world, and while we need to fix the root cause, we need to help our societies improve food systems, and we need to change the way that we're living. We need to walk more, ride bikes, be more active, get away from behind our computer screens. The reality is we live in the world we live in, and we have inherited kind of the world of obesity. And these medications allow us to change the trajectory of what happens when we hold on to excess weight into the second half of life. So instead of just treating high blood pressure, heart disease, type 2 diabetes, I believe these medications are going to allow us to treat early and prevent a lot of disease. So we should not be scared of them. My hope is that it helps us transform our health system currently. My goal as an obesity medicine doctor who truly admires and values these medications is not that we're all on them. I hope that in 2 generations, we've had an opportunity to fix what's gone awry in our global health system. But in the meantime, we use these medications to help us prevent a whole host of diseases.
All right, Dr. Alexandra, I appreciate you joining us on ET Now and, of course, helping our viewers better understand that thought process behind the book. But for the moment, we leave it at that. Let's quickly shift our focus to more that we're tracking here on News Now. Even as Trump versus Musk saga make headlines, there's some